Hi, my name is Lydia Davis, and I'm a student at Tennessee Wesleyan University. Today, I'm going to be sharing the research that my group did this past semester. Our topic was Tennessee County radon levels and comparing that to uninsurance rates and seeing the relationship between the two. So, some of you may be asking, what exactly is radon? And radon is a colorless, odorless gas that seeps into homes through cracks and holes in the foundation, and it comes up from soil and water, and it's overall the second leading cause of lung cancer. The overall purpose of our study was to determine any potential relationships between Tennessee counties with higher radon levels and the uninsured population rates. For our materials and methods, the study involved a quasi-experimental mixed methods approach, utilizing secondary data from the Tennessee Department of Health, County Health Rankings and Roadmaps, and as well as the American Cancer Association. We also conducted an interview with Lexi Brown, and her official title is the project official for the Tennessee Radon program. We had two independent variables in our research, which included the uninsured population percentages for each Tennessee county, as well as the stage of lung cancer diagnosis. And then the dependent variable was the level of radon per county. So we asked Lexi Brown several different questions, and we noticed that Tennessee had not yet adopted any radon modules in their BRFSS, which is the Behavioral Risk Factor Surveillance System. So our question to her about that, we just kind of wanted to know more, maybe if she knew why Tennessee hadn't yet adopted those questions, and if she knew about a time maybe when they would begin to adopt those questions into it. We also asked her if, what's being done in East Tennessee to offset higher radon levels along the Appalachian Trail. And then we asked if someone has no insurance coverage or cannot afford radon mitigation services, what kind of help is out there and available to them. And then that kind of led into our next question. We asked, is radon treatment funded personally or by the state? And then we noticed that there was definitely a high interest in the radon program, Tennessee Radon program, and they actually give out free home test kits for radon. And we noticed that there was currently none available when we had at the time last checked. So really we just wanted to know where majority of this interest was coming from and if she knew when they would get more test kits back and just more about that. And for these qualitative questions, trustworthiness was conducted through member checking, peer review, and naturally through triangulation of the mixed methods approach. So for our preliminary findings, the relationship between counties with higher levels of radon and uninsured population rates was investigated using Spearman-Rowe. Preliminary analysis were performed to ensure that no violation of the assumptions of normality and linearity. There was a strong positive relationship between the two variables, with high levels of radon associated with higher uninsured population rates. And then there were three themes that resulted from our interview with Lexi Brown, those being awareness, priorities, and accessibility. So according to Ms. Brown, East Tennessee definitely seems to have a higher interest in obtaining radon test kits, and assistance for these has definitely been scaled back for radon testing, but larger cities were definitely able to get the majority of those tests, and more rural areas were then not able to receive as many test kits within this past year, which could definitely be affecting people in those lower income housing areas. So for next steps, there are 29 counties within the state of Tennessee that are at a higher risk of radon exposure with a reported average indoor radon level being at 4.3 or greater. And out of these 29 counties, only 7 of them are urban areas, the rest being rural areas. And as many of these high-risk counties are also experiencing higher uninsured rates, an assumption can be made that many of these families cannot afford to properly test their homes for radon and receive proper radon mitigation services. So the results definitely speak to the need of finding ways to help mitigate radon, considering that counties with high radon levels are also having higher uninsured population rates. Individuals within these counties may have limited access to mitigation efforts and possibly preventative health services specific to lung cancer. And so below is in the right corner, is our 3 references. But these were our findings, and I hope that you enjoyed, and thanks for listening.